Hi, Assalamualaikum Dr. Maria. My name is Husna Binti Halim. So my ID number is 2020271032. My topic is insomnia or sleep disturbance among elderly. So hope you enjoy my presentation. Okay. When we talk about sleep disturbance or insomnia, did we know what is insomnia or sleep disturbance? Insomnia is a sleep disorder characterized by difficulty falling asleep, staying asleep, or waking up too early or not being able to fall back asleep. It can result in fatigue, irritability, and difficulty concentrating during the day, which can have a significant impact on an individual's overall health and quality of life. As our knowledge about how sleep changes with age has grown significantly over the past few decades, researchers have shown that there are typical age-related normal changes that occur in sleep architecture and sleep patterns. However, aging is also accompanied by a variety of sleep complaints and sleep disorder. When aging, people spend more time in bed but less time asleep. Sleep becomes less efficient and more disrupted. This goes along with decrease in slow wave sleep and increased early morning awakenings. Okay, next we go to the prevalence. The prevalence of insomnia varies depending on the population studied. Globally, the prevalence of sleep problems increased from the age of 65 years. Approximately 50% of older adults suffer from difficulties in sleeping, of which up to 30% suffer from insomnia and 20% suffer from sleep apnea. While in China, studies shows that there is an overall prevalence of poor sleep among elderly has reached 35.9%. Apart from that, studies has estimated that around 10 to 30% of adults worldwide suffer from chronic insomnia. And then, one study found that the prevalence of insomnia in United States was 23.8%, with 6.2% of individuals reporting severe insomnia symptoms. So, we talk about in Malaysia, a study among Malaysians adults aged 30 to 70 years reported that the prevalence of insomnia symptoms was 33.8%, and while 12.2% of them had chronic insomnia, particularly among elderly people. Then we go to the symptoms that may occur include the elderly will having difficulty to falling asleep, difficulty to tell the difference between night and day, and they always have early morning awakening, and sometimes waking up often during the night, for example, due to the nocturia. Okay, next, we go to the causes. There are many potential causes of insomnia, including psychological factors such as anxiety and depression, medical conditions such as chronic pain and respiratory problems, and lifestyle factors such as caffeine and alcohol consumption. Certain medication and substances such as nicotine and stimulants can also contribute to insomnia. A study shows that higher wastage of vegetable in meals also increase risk of insomnia by 4 times. Vegetables contain various nutrients such as magnesium. Magnesium treatment may be a useful alternative therapy in patients with mild or moderate restless leg syndrome related to insomnia or periodic limb movement during sleep that related to insomnia. Okay, why we talk about the magnesium? Magnesium deficit cause a number of neuropsychological disorder including sleeplessness. This can be explained by magnesium ion regulating calcium ion flow in neural calcium channels. It can help to regulate neuronal nitric oxide production. In magnesium deficiency, neuronal requirements for magnesium may not be met, causing neuronal damage, which could lead to related and accompanying mental illness, including insomnia. Then we go to the risk factor. Research has shown that insomnia can have negative effects on both physical and mental health. For example, studies have found that insomnia is associated with an increased risk of hypertension, cardiovascular disease, diabetes, and obesity. Insomnia also have been linked to mental health conditions such as depression and anxiety. Sleep problems in older adults can cause fatigue, daytime sleepiness, and napping. Sleep problems also affect general functioning, activities of daily living, and are associated with poor quality of life, as well as cognitive and mental health issues. Furthermore, they are associated with an increase in function impairments and the development of cardiovascular disease, metabolic system, diabetes type 2, and obesity. In addition, subjects who had insomnia were 20 times more likely to be depressed than those who did not, and vice versa. Thus, insomnia and depression were interrelated. Similar findings were reported earlier. Insomnia and overlooked risk factor for late life depression. According to Hall et al. 2000, symptoms of stress and depression were significantly correlated to hyperarousal throughout non-rapid eye movement, sleep in insomnia. Study also showed that elderly people reporting short sleep duration are less likely to meet the physical activity recommendation for their age group. Yet, those reporting long sleep duration and good sleep quality are more likely to meet the same recommendation for physical activity. These results present some new evidence of the independent association between sleep duration and sleep quality with physical activity in this population. Then, the findings suggest that long sleepers and those report good sleep quality are more likely to meet physical activity recommendation from Stephen L. 2018. Then, when we talk about the burden in aging, the aging process alters the stage of sleep, and elderly that have this problem tend to be prescribed pharmacological treatment. So, everything that goes on this elderly population has long-term side effect and result in increase of health costs. Okay, so what is physiotherapy roles in elderly to overcome this problem? So first of all, we can give physiotherapy education on lifestyle changes such as establishing a regular sleep schedule, avoiding caffeine or alcohol before bedtime, and engaging in regular exercise can also be effective in treating insomnia. Furthermore, there is evidence for a beneficial effect of regular physical activity and exercise on sleep in adults in general, and in young, middle-aged, and older adults specifically. So, moreover, physical activity and exercise tend to be associated with decreased use of sleep medication. So, physical activity taken regularly may promote relaxation and energy expenditure in ways that is beneficial to initiating and maintaining sleep. Therefore, using physical activity as a non-pharmaceutical treatment option for sleep problem could constitute an inexpensive, accessible, and simple means of improving sleep in older adults. Although various studies have examined the effects of physical activity on sleep in general healthy older adults, the evidence has not yet been summarized. This constitutes a gap in the literature given the the age-related declines in physical activity and sleep, which are both important health indicators for successful healthy aging. Lastly, overall, insomnia is a common sleep disorder that can have negative effect on both physical and mental health. It is important to seek treatment if you are experiencing symptoms of insomnia, as there are many effective treatments available. Okay, thank you.